Hello and welcome back to the final segment on intraoral camera. This segment is going to be on the restorative appointment and how we use the intraoral camera there. Now, we've talked a little bit in the past about the new patient experience and how the intraoral camera is tremendous for helping us build trust. We take 6 photos there. We talked about hygiene and the 4 images we take to help educate our patients, to help build value, and to help keep our appointments as efficient and effective as they can be. And we'll talk today about the restorative appointment and really 2 types of treatment, one totally different from the other. Now, the day-to-day in restorative in most practices is taking out old restorative dentistry and replacing it. Sometimes it's with a direct restoration, sometimes it's indirect. In our office, a lot of times it's CAD/CAM, so it's directly indirect, I suppose. But either way, no matter what that treatment is, to build value and to help educate, we like to take a pre-op image of whatever we're working on. Maybe it's to show the crack, show the broken cusp, maybe simply to show the ugly old amalgam that we're going to take out. If we take a pre-op, inherently we're going to follow up with the post-op, so we can showcase to our patient that beautiful direct composite, that gorgeous porcelain inlay, onlay, or full coverage crown. Whether we've done it in our office CAD/CAM or you send it to a lab is irrelevant, but to have a nice post-op picture to remind your patient of where they've come from and where you brought them, excellent. Now, the image that many people neglect to take that can be really, really effective is a mid-treatment picture. Now, we don't take this all the time. We take it essentially if we find a surprise, something we've not discussed with our patient prior to working on that tooth. So imagine somebody comes in and you're taking out an MOD amalgam and you've prescribed an MOD composite. You know, it looks pretty straightforward. They've got a lot of good tooth that you can see clinically and you're not really expecting anything unusual. Well, what happens when you take that out and there is a nice fracture running from the mesial of the tooth to the distal across the pulpal floor? Now, for those of you who are in clinic already and seen some patients, or maybe even your second year and you're familiar with this in class, you know that when that happens, we're no longer putting a direct composite in and calling it a day. We're either putting a composite in and doing a build-up so we can put full coverage on the tooth, or we're going to place an onlay on that tooth. Either way, we've got to cover the cusps. But that's really apparent to you and I, and the need for that. You know, what does your patient know? What your patient knows is they came in for a filling that was going to cost them a couple $100, and now they're walking out the door with either an onlay or crown, maybe a build-up that's going to cost them a couple $1,000. So, inform before you perform. Take a picture of what you see. And all of a sudden, everything gets better, all the problems go away. Your patients get to visualize what you visualize, and things start to make perfect sense to them. And it gives you an opportunity to have a 2-3 minute conversation about what you both see and what that means to the treatment needs that they have now. Same thing with decay. Maybe you open up a tooth and you know there's going to be some recurrency there, but it's a disaster inside the tooth. And now you're thinking, instead of a simple direct restoration, that this tooth may even go endo. Well, before you go in there and remove all that decay and expose a nerve and they get mad, take 30 seconds to take a mid-treatment picture and let them see what you see. And as you progress, if you're going to expose the nerve and you can see that pink shadow underneath, before you do, if there's more decay left, take a picture. Let them see what you see. It'll make perfect sense and it'll make your life a whole lot easier. Trust me, mine got way easier once we started taking more pictures. So that's the day-to-day in restorative. But the other really nice use for this camera during a restorative appointment is Invisalign. Now, for years, we used our Nikon, we used our Canon, and we took all of our Invisalign photos, and they're beautiful pictures. But here's what I know. Back to the efficiency and effectiveness. My assistant is not real comfortable holding my heavy ultra zoom lens Canon camera. She gets a little nervous with that. She does not get nervous with this lightweight camera at all. So she can take my full face pictures, she can take smiles, retracted views, occlusal views, the whole 9 yards with this one camera, which makes my life a whole lot easier. So restorative functions, Invisalign, excellent to use the intraoral camera. Educating your patient with mid-treatment photos is great. Taking nice befores and afters to build values will really help your day-to-day and help your business grow. Thanks for listening. I'm glad you tuned in to the intraoral camera series, and we'll talk soon. Take care.